Hi, everyone. I hope you're all having a great Saturday. So there's one thing that I've wanted to talk about on my show for a really long time, and that's thyroid and fertility. And I finally met someone who's just as passionate about the thyroid as I am about fertility. I mean, that's pretty cool. So her name is Dr. Maren, and she has a podcast coming out soon called Hey Mommy, Mami. And I'm so happy that she's available today, and she's going to chat with us about fertility and thyroid. So I hope you'll listen in on this conversation right now. She is wonderful. And let me just gonna do this. 1 second. I'm gonna come up right now. Hi, Christine.
Hi. So good. How are you?
I'm doing great. Well, thanks for being available today.
Of course. I'm excited to be here.
There's one fun fact about you that we just learned a little bit ago, and that's the fact that we both have a mole right here. Isn't that fun?
Wrong side.
Twins. Yeah, we're both mole twins.
Yeah.
Well, awesome. So just tell us about yourself and like why you went into medicine and why are you so passionate about the thyroid?
Yeah. So I went into medicine because I wanted to help people. I mean, as cliche as it sounds, like that was my thing. I was in undergrad at the University of Colorado at Boulder. I was doing a finance degree, which I finished, but I studied abroad in Mexico, and I also did a program called President's Leadership Class. And both of those things really just instilled the sense of service in me. And I found that I also was just really drawn to the sciences. Like I had a friend who, he sat down next to me in finance class and opened up the newspaper and was reading about stocks. And I was like, I could really care less about that. Like literally I had no care in the world. And I was reading something about, like I taught group exercise classes at the time, which was like an awesome job in college. And I was really into fitness and nutrition and all of that. So I really just kind of, I knew that my calling was more in the health sort of realm.
Right. Well, I love that. Yeah. I mean, I would roll my eyes at the stocks too.
Yeah.
I'm right there with you.
Who cares?
And then what about fertility? Do you have a fertility story that you wouldn't mind sharing with us?
Yeah. So I struggled with pregnancy complications throughout all three of my pregnancies, really, mostly my second. But with my first child, it took not long to get pregnant, but I had gestational diabetes, and I just felt like there was something wrong. What is that about? I had 0 traditional risk factors. And that's when I really dove into nutrition. But fast forward a couple years, I tried to get pregnant with my second. My husband had just returned home. He was deployed as a military surgeon. And we were on a timeline and ready for our second baby. And I had a miscarriage. It took me a while to get pregnant that time. And then I had a miscarriage, and then I had another one. And, I saw a fertility specialist, and ultimately my diagnosis was unexplained infertility. And I felt like there was an explanation. There had to be. I just knew there was something wrong. I mean, I had other symptoms going on, and I just felt like they were all connected. And so I took a deep dive at that point into my own health and discovered a lot of things, including thyroid dysfunction. And, I had a successful pregnancy, and I had my son. And after that, I got really healthy and I felt really good. And then I had my surprise third.
Wow. For those of you guys who are joining us right now, this is Dr. Maren, and she's a thyroid specialist, an expert, and we're talking about, and functional medicine doctor, and we're talking about fertility and thyroid today. So thank you again for joining us. And then tell us more about your connection to thyroid and why you're just as passionate about the thyroid as I am about fertility.
Yeah. So I'm a thyroid patient. Taking thyroid medication changed my life. My sister's a thyroid patient. My other sister's a thyroid patient. My mother-in-law, my mom. I mean, all the people who are close to me are thyroid patients. And I see so many people, and I work with so many people who, get on the right dose of thyroid medication. It's literally life-changing for themselves and for their family. I mean, as a mom, I work with lots of moms, and like our energy sort of trickles down into the rest of the household. And so if mom doesn't feel well, and I would say as a mom, I was at a point in my life when my thyroid was off and I felt like I short-circuited. It was like I couldn't multitask. I had all these people asking me for stuff all the time, and it's hard. And so I think, you can change people's lives with proper thyroid management.
Right. And then what symptoms should someone look out for that could be a sign of having a thyroid problem?
Yeah. So if you're super exhausted, fatigued, feel like you've short-circuited, those are things to watch out for. It can also really influence mood for some more than others, depression, anxiety, that sort of thing, or just having a flat mood. Infertility is a symptom. So is having irregular periods. So if you're not ovulating regularly and you have irregular cycles, it's something to look at. Gut dysfunction, especially constipation, but there could be other kinds of issues going on as well. Thinning hair, hair loss, thinning of the outer third of the eyebrow, feeling really cold, like cold to the bone. If you wear a wearable, like I wear my Aura ring and you see that your body temperature is really low, that can be thyroid related, or low heart rate or pulse. It can also be, very metabolic. So having high blood sugar, high cholesterol, having problems losing weight, unexplained weight gain, that sort of thing.
Mm-hmm. And so if you have any of those symptoms, what kind of test should you ask your doctor for?
So I'm a big advocate for a full thyroid panel. So that means TSH, free T4, free T3, reverse T3, thyroid peroxidase, and thyroglobulin antibodies. So that's 6 tests. It's not typically what a doctor orders. Typically your doctor will look at a TSH. Sometimes they'll order a TSH with a reflex to free T4. But what that means is only if your TSH is very abnormal or very high will you actually get to see what your free T4 looks like. So I think not only ordering those labs, but also making sure they're in optimal ranges is really important.
So not just like in the normal range.
Yes.
Just look at the whole pattern.
Look at the whole pattern. So if your TSH is like 4 and your free T4 is like 0.9 and your free T3 is like 2.5, I think I would give that person thyroid hormone. I mean, of course, it always depends on symptoms and how somebody feels, but generally that sort of person would benefit from a little bit of thyroid hormone replacement.
Right. And then what if like you're a patient, you're trying to advocate for yourself and the doctor will not order the full panel and they'll just do TSH and you have symptoms? What can a patient do to advocate for herself or himself?
So there is this misperception that lab testing is really expensive. And some lab testing is expensive, but a free T3 is like $20 or less. It's really, obviously check with your insurance. Like there is no, labs aren't transparent about what things cost, but I have cash pay rates for my patients who who don't have insurance, and it's literally like $20. So it's not an expensive lab. So there's this misperception that it's expensive. I will say also, if your doctor doesn't know how to interpret these labs, they might not be comfortable ordering them. And I can understand that, but I think you have to advocate for yourself. You can order them yourself. There's a lot of different ways you can go online and just literally, it's direct to consumer lab testing. So you can do that. But I think best option is to work with a professional who really understands thyroid, because there's a lot of idiosyncrasies in terms of timing. And then if you actually do need treatment, what does that look like?
Right. And then what's the connection between thyroid and fertility?
So thyroid and fertility is a big deal. Your thyroid, the reason people have irregular periods when they have thyroid disorder is because they're not ovulating. And so you got to ovulate to get pregnant. So that's a big deal. It's also important for maintaining pregnancy, especially in the first trimester.
And then what about, so first trimester, why is it a big deal in the first trimester?
Yeah, so especially in the first trimester, we have a big change in sex hormone binding globulin, which is totally natural. We know that a pregnant woman will have like sky high, well, maybe not sky high, but we know it increases a lot when we get pregnant, and that's totally natural. But we also know that our need for thyroid hormone replacement increases by probably at least 30% when we get pregnant. So in your first trimester, if you're working with a thyroid doctor and trying to get pregnant, or your primary care doctor, make sure they know that if you're trying to get pregnant, as soon as you have a positive thyroid pregnancy test, your medication should increase.
And then how often should a patient ask that her levels get checked if it's not being done already?
So if pregnant, I would check every 4 weeks, which is quite often, but it's a big deal in pregnancy. So I think that's important. If not pregnant and just trying to get to a good level, if you switch thyroid hormone replacement around, I would do about every 6 weeks if you're changing the dose.
Got it. And so let's say you were diagnosed with a thyroid problem. Do you have to wait a certain period of time once it's normalized before you should start getting pregnant?
I would say make sure that you have a stable and optimal TSH, T4, T3, that you know what dose you need and you get on that dose, because as soon as you're pregnant, you got to increase that dose by 30%. And it's helpful to know what dose that is, right? Right. So as long as if your TSH is like all over the map and you haven't figured out your dose, like give it some time so you can get even.
Right. And then what about after delivery? What happens postpartum to the thyroid function?
So postpartum, your dose will drop again. So, and that's natural because our sex hormone binding globulin will go back down. And we just have to be really aware, like postpartum thyroid issues are very common. First of all, we know that postpartum is a independent risk factor for autoimmune disease. And so Hashimoto's, which is an autoimmune disease that attacks the thyroid, can come up postpartum in the first year. That's a big deal, something I would screen for. But also just like postpartum depletion and really just this adrenal demand from being up all night, nursing, and all of these things kind of add up and put people at high risk for having thyroid disorders postpartum. The other big one is postpartum thyroiditis. And so if somebody's like feeling like super revved up and like maybe around 4 months, the classic sort of symptom would be like 4 months, they're feeling super revved up. They can't sleep even though they're exhausted. Their heart rate's like really fast. They're anxious. There's just postpartum anxiety that comes up. And then they like crash and they're so tired. That sounds like postpartum thyroiditis. So getting that full thyroid panel, including the antibodies, is a big deal.
And when postpartum should someone have those levels checked?
So I like to check them 6 weeks, 6 months, and a year, unless somebody's having symptoms. So if there's symptoms that come up around 3 months, I would check them at 3 months.
Great. And then if someone has been diagnosed with a thyroid problem, is there a cause for concern? Should they worry about things long-term for themselves?
Yeah, I think long-term, if it's not controlled or not treated appropriately, then yeah. Thyroid just guides your metabolism overall. And so, there are long-term sort of risk factors if you're hypothyroid with all sorts of things. Blood pressure, cholesterol, depression, infertility, all of these kinds of things come up. And so having your thyroid hormone regulated in the right way is a really big deal. I just think of it like any other hormone replacement. We've got to replace that hormone too if it's under functioning.
Awesome. And then what do you think the ideal TSH is? And is it really just the TSH for fertility, or is it the TSH with everything else?
Yeah, I think it's the TSH with everything else. And so I say ideal TSH is about 1. We know that the upper limit when we're talking about fertility is 2.5. On your lab order, you might see like 4.5. And so, it's not like, it might be in a normal range by the labs, but really thinking about that optimal range is a big deal. So I would say ideally getting your TSH close to 1, between 1 and 2 would be ideal. Getting your free T4 above 1, so maybe around 1.1 to 1.4, and getting your free T3 in the 3s. A free T3 in the 2s is maybe the reason that you feel like garbage. So even if your T4 looks normal and your T3 looks low, there's a conversion disorder. In the medical literature, we know this as like euthyroid 6 syndrome. It's really just T3 conversion disorder because there's inflammation, toxins, infections, whatever. If you're not converting and you don't have enough T3, you can feel functionally hypothyroid. And that's not always the problem with the gland, because your gland might be producing enough T4, but you might not be converting it to T3.
Mm-hmm. And if someone, let's say, just wants to maybe try to control their thyroid naturally, is that really a thing? Like, are there things that you can do naturally to control it, or should you really consider medications and natural, or, things like lifestyle changes? What is your opinion on that?
I'm a fan of natural lifestyle changes, nutrition combined with medication. I think some people can achieve that. And I think definitely if there's an autoimmune component to the thyroid problem, that is definitely more of a natural approach to treating Hashimoto's. So it's like a 2-pronged thing. It's number 1 is treating the autoimmune component. Number 2 is treating the hormone replacement. So iodine can be used sometimes, but is quite tricky. It's, I think, more of like a medication than a supplement, because when you use too much iodine, you can give yourself a goiter and mess up your thyroid. But it's in our Hey Mommy literature, we call it the Goldilocks hormone, because it's like too little is not good, but too much isn't good either. So I'm pretty conservative with iodine. I don't like to use it in anybody who has Hashimoto's or an autoimmune disease, but using low conservative supplementation, like 1 milligram, is pretty safe in people who don't have Hashimoto's. Nonetheless, it's not going to be like an overnight change for thyroid most of the time. So I think that nutritional changes, lifestyle, sleep, certain nutrients, all these things can influence thyroid function in a big way, but ultimately most people benefit from thyroid hormone replacement. Of course, it depends on, how bad their hypothyroidism is.
Mm-hmm. And then can you tell us a little bit more about what specifically are the nutritional and lifestyle changes that you would recommend to someone?
Yeah, so in terms of nutrients, some of the most important ones are iron, selenium, zinc, vitamin A. Some of the B vitamins are a big deal too. What am I missing? Tyrosine, which is an amino acid, is a big one too. And exercise, actually. Exercise influences your thyroid hormone receptor sensitivity, as does vitamin A. Note to people who are trying to get pregnant, don't take a bunch of excess vitamin A. That's not safe, but it is an important nutrient for thyroid and something you can get safely through foods. So those are all important. I think also thinking about just like good quality sleep. Sleep is a big deal. So when we talk about HPA axis dysfunction and sort of adrenal health and stress and cortisol, all of these things are going to be really influenced by sleep and overall stress, sort of our parasympathetic or sympathetic nervous system, our fight and flight response. We want to really get into this place of not sympathetic dominance, but have some balance there where our parasympathetic nervous system is really on fire.
And how do you measure your quality of sleep?
Yeah, so I use this. This is my Oura ring, OURA. This tells me what my REM sleep, my deep sleep, my light sleep, how many times I wake up, all of that. So that's what I use. I love it. My husband has one too now, so that's my go-to. That's usually what I recommend for patients.
Okay.
And put it on airplane mode, by the way, when you're wearing it.
Okay. Why airplane mode?
Oh, we won't deep dive in EMFs, but I feel like just to be, the literature is sort of out there on EMFs, but I just play it safe.
And EMFs is electromagnetic frequencies?
Yeah, from cell phone and all these things. So I usually counsel my patients, like, just do simple things. Like, you don't have to like put foil on your windows, right? Just like keep your phone on airplane mode and your ring on airplane mode and shut off your Wi-Fi at night. Like, that's not going to hurt anybody. It might be a good idea.
That's a very good tip. I think I might need to be telling patients that, along with checking your TSH, free T4, and free T3.
Yes.
Not just TSH and free T4. That's your recommendation.
Yeah, for sure.
Perfect. Well, thank you, Christine, for joining us today. I really appreciate the time. Can you tell us more about you, your upcoming podcast, and more that you
So I am, you'll see me right here on Instagram at Dr. Christine Maren. My website's the same. And I have a new project called Hey Mommy. It's MAMI with my colleague and friend, Dr. Alex Carrasco. And we are launching a podcast very soon where we interview you on all things fertility and infertility sort of workup. And we'll have a lot of great interviews there. Our goal is really just to help women have a healthier and happier mommyhood. So everything from preconception through pregnancy and postpartum and beyond, really. So,
well, now that you've come on here, what I think I'd love to invite you to do is just a live Q&A all about thyroid. And I'm sure that we'll get so many questions. We'll get these content. Will you come back in maybe like a month or so?
Totally.
Maybe closer to when your podcast launches?
Totally. I'd love to.
Awesome. Okay. Well, thank you so much for your time. I really appreciate all the wisdom. Thank you for sharing personal stuff about yourself and telling us why we should be very passionate about our thyroids as well.
Of course. Thank you.
Okay, cool.
All right.
We'll see you soon. Bye, Christine. Thanks.